Test, test, test. Test 1, 2. Test, test. Test, test. Test 1, 2. Test, test, test. Test, test, test. Test 1, 2. Test, test. Test, test. Test, test, test.
Hi, Kevin. It's Ellen.
How are you, Ellen?
Good. I'm good. How are you doing?
Okay.
Let me see if I can.
All right.
Oh, here. I'll turn on my camera for a second. Say hi.
Okay. I'm
Hello.
not in front of my camera, but I'm back by the podium.
Oh, okay.
But yeah, we can hear you fine. You can say hi to
Okay.
Sela's here.
Oh, hi. Hello, Sela.
Vinny and Michelle and Bill Gaylord.
Hello. Bill, are you on? I can't hear.
Bill, you're on
Your
mute.
mic is
Thank you,
muted,
Bill.
Bill.
There we go. How about now? Happy Thursday, everybody.
Happy Thursday.
Dr. Eisenstein. We can see you fine. Do you want to test your mic?
Sure. Can you hear me?
Yes.
Great.
Okay, you're all set. Michael Pulitzer, the clerk of the legislature, says hello.
Send him my regards.
You have his regards, Michael.
Thank you.
Kevin, I'm testing the mic. Do you hear me?
Who's that?
Kevin, do you hear me?
Hang on one second. Who's on?
Howard, I just checking the mic. You hear me? I'm kind of muffled as usual. Okay. Plenty close to. Plenty close, but okay. All right, doesn't matter. I'm fine.
Test, 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 test. Test, test. Okay.
Green light, you can already see, but
Okay. Yeah, I see it.
then you're live.
Kevin, does the mic work better now? Kevin, do you hear the mic better now?
Yeah.
Hey, Jerry.
All right, do you hear it better now? Is it a little bit better now? No?
Did you?
Okay. I
Boy,
don't
what did you?
understand. Okay. Okay.
I want to invite the legislators to the chambers. I'd like to get started early. Dr. Eisenstein has limited availability this morning, and so we certainly would like to hear from him and have as much time with him as possible. call this hearing of the legislature to order and ask Legislator Tom McKevitt to please lead us in the Pledge of Allegiance. Thank you, Tom, and thank you to all the legislators who are here and participating remotely. I'm going to say a few words at the beginning and jump right into the program. We have Dr. Eisenstein, our Commissioner of Health, available remotely for approximately an hour. We also have Kyle Rose Lauder, the Deputy County Executive, as well as Jerry Giuliani, who's counsel to the Department of Health, to speak with us today. We also have a tremendous number of comments that we've received via email. It's unfortunate that we could not have the public here participating directly, but obviously with COVID, it's much too much of a concern at the current time. And hopefully many of our residents are watching this on the stream on the Nassau County website. Although the plan for years has been for the local departments of health to administer vaccines in a situation such as the one that we are in now. The state of New York, when the vaccine rollout began, decided that it would control this process completely. And it has done so using local hospitals as an exercise of that control, providing Nassau County and other counties throughout the state with a very limited role to play. I personally want to thank Dr. Eisenstein and the Department of Health for what they have done to date. Dr. Eisenstein's leadership and the information he's provided us, which we provided to the residents, has been exemplary, and we really appreciate all that you've done and all that your staff has done. The vaccine began distribution in December, mid-December, and to date, only a small fraction of our population actually has been vaccinated. Unfortunately, most of us expected more. I think we can safely say now that it looks like it'll be a number of months before we have sufficient vaccines in arms to get anywhere near a herd immunity. Again, this should not be, what I'm saying is this should not be a criticism of our Department of Health, and I'll repeat that I believe our Department of Health has done an excellent job with the limited role that they've had and the limitations that have been imposed upon them by the New York State, But the rollout otherwise could not have been much worse. The state has increased eligibility, including in 1 week going from 75-year-olds to 65-year-olds, to the point where millions of New Yorkers are eligible for the vaccine, hundreds of thousands of Nassau County residents are eligible, and there is, as we all know, a very limited supply. The obvious result is that the system has been overwhelmed. The most concerning part of that is that we are not getting enough vaccines to the most vulnerable part of our population. You know, all of us as legislators have heard from our residents through email, telephone calls. We've had an incredible number of public comments that have been submitted for this hearing. And far and away, the biggest issue, the biggest complaint is the vulnerable people in our population, especially the elderly, 80-year-olds, 90-year-olds, not being able to get the vaccine. We've heard from those elderly people, senior citizens. We've heard from their children who are concerned about their parents. And we've heard from many people with underlying conditions, disabilities, etc. They've had difficulty with the state's website. They've been unable to get through. When they've gotten appointments several months out. Telephone numbers have not worked adequately. Here in Nassau County, we had begun vaccinations with the limited supply that was provided by the state, and we're providing that to the general population of eligible residents. We were directing our seniors as to how to contact the county to obtain those vaccines, and the state, a week or so ago, decided that the county itself directly could no longer provide to the general population, but had to provide to first responders and transit workers, leaving many seniors unsure of where to go and how to get their vaccine. In today's paper, the governor again notes that Long Island has the highest positivity rate in the state, the Long Island region. In his words, Long Island, Long Island, Long Island. And yet, we learn that New York City is restricting appointments to its residents and those who will work in the city. And today we read that the state has opened a mass vaccination site at Yankee Stadium, providing 15,000 doses in a week, which is almost as much as they've given to Nassau County to date. We need our leaders to advocate more strongly on behalf of this county. In particular, we must call upon the governor to open a mass vaccination site at Nassau Coliseum similar to Yankee Stadium. Again, the county's positivity rate is the highest in the state. We're also calling again for New York City to open their vaccination site to all residents, such as the county itself is doing and the state is doing. Most of all, let's change the focus of what this vaccination rollout is and go back to what we should be doing, which is protecting the most vulnerable. We've known for over a year, and Dr. Eisenstein has said this countless times, that those who are most vulnerable, the seniors, especially those with underlying conditions, general population with underlying conditions, are most at risk for serious ailments, for possible death. Those are the people that should be protected first. I mean, other states have done this. We have to do more to accomplish that. Again, we have many public comments. I'm not going to read them. They're all going to be included in the record. We have the points that have been raised, and we will attempt to raise every one of those points during the course of this hearing. I just wanted to briefly mention the individuals, and I will give this list to the stenographer, the individuals who sent public comments: Amy Solomito, Richard Siegelman, Kathleen Lynch, Jim Caulfield, Joan, no name provided in the comment, Virginia McNamara, Barbara Thompson, Lorraine Stanton, Ray Muntz, Diana Leffel, Liz Mancini, Phyllis Friedenthal, Stephen Breslin, Shari Bitton, Kathleen Lynch, Selma Miller, Kathy Basile, Slatsky Dorothea Young, Linda DeRocha, Ida Iacovino, Nina Gavan, who is the president of the CSCA at Nassau University Medical Center, Dr. Sharon Lorena, Tony Tomasulo, Mark Binderman, Nicole Pazin O'Neill, and a number of others who did not leave their names but have their email address. Again, we saw every one of those comments, we read them, and we will be raising the points that you've raised during the course of this hearing. Your comments will also be included as part of the record. So I want to thank you all again for giving me the opportunity to make those remarks, and ask Dr. Eisenstein if he wants to start things off with a statement, or would he rather just go to questions?
Just very brief statement. I want, the legislature has been great in our weekly meetings, and I thank you for the opportunity to testify and answer any questions. I'm very proud of the work that the Nassau County Department of Health staff have done. We're up to the vaccination stage of the response to COVID, which is something we dreamed about for the first 10 months, but it has been around the clock for all of us. I'm very grateful to County Executive Curran for giving me the support that I've needed all the time, even including last week when we felt that there weren't enough vaccines for seniors coming to the county. There's still not enough, but with her help, we advocated and got a supplemental 600 dose allotment last week that we were able to give to seniors. We didn't get that this week because pharmacies opened to start vaccinating seniors, but I'm very appreciative of the support I've gotten. And, it's the health department. I want this to be clear on the record. More than 100% of the vaccines that we have been allotted have gone into arms. And we're able to go over 100% because we have, in most cases, we've been given Moderna vaccine since our first day on January 5th. The governor had given us 7 days to use each allotment, and we've cleared it out way before that. And we've gone over 100% of our allotment because the Moderna comes in vials of 10 doses, but they actually package it with 11. And in most cases, with the proper size needles, and we've shifted to smaller needles, which work just as well for injections safely and effectively, but we've been able to get the 11th dose, which was not accounted for in our allotment. So we've actually done above 100%. Yesterday we were a little bit delayed because of the snow, and that's one of the reasons we're heavily booked these days, even over capacity, but I'll be there to help shortly, and we are going to get it done. Yesterday we started second doses for people that received their first doses with us. And IT's been very helpful. I want to thank IT for helping us put a second dose platform in such that everybody who gets a first dose gets an email within a day or so, giving them the appointment. And 87% of people who've gotten the first dose have made an appointment quickly. We then reach out to everybody who doesn't respond to make sure we have the correct email and get them second doses. And as of yesterday, we passed the 15,000 total doses given just by the health department at our 2 sites, plus the 1 site we did at a church in Hempstead on Dr. Martin Luther King Jr. Day. Of those 15,259 doses, 14,716 were first doses. And now we're up to where we're going to be doing first doses and second doses basically every single day straight through. And it's a lot of work, but it's very rewarding. And this is why a health department exists. And I'm very appreciative of my staff who's there 7 days a week, very long days. And I'm very appreciative of all the support I've been given. So I just want to put that on the record before we begin.
Okay. Dr. Eisenstein, as I mentioned before, a couple of weeks ago, the state changed who was eligible to receive the vaccine at the Nassau County sites. What do we do? How are we directing our seniors in terms of where they must go? The eligible seniors where they must go to obtain their vaccines? Is it to the pharmacies, and what is the procedure that they should be following at this point?
Okay, so in the very beginning, the first few weeks, seniors were not on the eligible list. And then when they became eligible, it was 75 and over, followed the next day by 65 and over. And at that point, they were on the list of people that we were able to vaccinate. So during the first couple of weeks that seniors were eligible, we did a comprehensive amount of a very large percentage of the vaccine that we were allotted those weeks, probably in the realm of 75 or 80%. What were given to seniors. With the help of Commissioner Carolyn McCummings, Commissioner of Human Services, under the leadership of Deputy County Executive Rose Lauder, the Office of the Aging worked to set up a process where people were able to get on a list and get instruction, and guiding them is still something that we're trying to do. And what I was doing is asking for a set number of people from the list of seniors that we tried to reach. We worked very hard to reach seniors in underserved communities using community leaders who were in touch with people that might not have computers or might have difficulty accessing the internet. And so for what the process is now with getting seniors, so I would say, send us X number of seniors each day with a list. And now we're continuing on. As of about 2 weeks ago, seniors were assigned, the governor outlined who can vaccinate who. And the local health department is no longer eligible to vaccinate seniors. We've been given a list of prioritized essential workers. So it's not all essential workers, it's those on the priority list, which includes police and fire, transit workers, airline workers, teachers. Just in the last day or two, the governor said that he's going to be adding restaurant workers, and that. So that's what we've been assigned, and seniors since then have been assigned to be vaccinated at pharmacies, which started getting vaccine. A bunch of Walgreens in the county started getting vaccine this week, as well as at the mass testing sites that the state has stood up. There's one in Jones Beach and another at Stony Brook on Long Island. But I'm happy to turn it over to Deputy County Executive Rose Lauder to discuss what the Office of the Aging and how we're organizing support for seniors.
Good morning, everyone. What we're doing in the Department of Human Services is we obviously noticed at the beginning of our vaccination program that the calls to our Department of Health calling center just shot up. It went from hundreds of calls a day to thousands. And so and obviously with the staff that we had at the calling center, we did not have sufficient staff to handle all those additional calls. So what we first did was to pull staff from other departments, mainly the Department of Social Services, and chose those staff that are used to speaking to people and helping and know how to assist our seniors best, and those from the Office of Aging as well, and started to get them trained so that they could take on some of those calls and start assisting our seniors. What we did, because this population is obviously had difficulty navigating the website, and the website was crashing, and it presented a lot of problems for our seniors. Our concept was to take their names and their numbers so that we can pre-register them and put them on a list, and then provide that list to the Department of Health for the pods. And so that's what we started to do, and not only were we getting calls through the calling center, the Office of Aging was getting calls. Many governor elected officials were giving us information from their constituents that they were having difficulty in giving us names. So we were receiving, and community as well, just calling in for their friends and their families, churches, calling us about how can they get their seniors vaccinated. So we started compiling lists from all of these different areas, and when the county executive was successful in getting the state to allow us to vaccinate an additional 600 last week, we pulled from those lists. Now, we had thousands of seniors on the list, so obviously many were going to be left out, but we tried to do it as fair as possible by pulling from various lists and looking at those that were most vulnerable, our older seniors, and tried to get them into our system. So that's what we were doing and we're still helping the calling center, because our calls, while they have diminished some since the seniors can no longer be vaccinated by us, we still have a tremendous amount of calls. It is skyrocketed almost from the beginning of the pandemic, but obviously during the summer there was a lull, and now it has picked up again. So we have our Department of Human Services and Department of Social Services both assisting with the Department of Health to alleviate some of that backlog and be able to at least get the people on the phone and direct them. Now, unfortunately, we don't have a lot of direction to give them, because we know that the pharmacies, there are very few pharmacies here in Nassau County that are part of the program, and hopefully more will be coming online soon as more vaccine becomes available. So we do tell them that is an option for them, as well as the state system, and that's the most information that we can give them at this point. And obviously, if the state relaxes the responsibility and it allows the Nassau County to resume vaccinating seniors, we'll do that, and we'll continue to do that by pre-registering them so that they don't have to worry about having access to computers, and that we can get them to our pods and get them vaccinated.
Okay, so then seniors are directed now to go to one of two places. It's the pharmacies and the state site.
That's correct.
Now, with respect to the pharmacies, are they to how do they know that a local pharmacy is participating? Are they supposed to go and get themselves on a list before the doses are even available? I mean, what's the process? What are we telling people to do?
The only information we got information that there were 4 pharmacies, Walgreens locally, that had been allotted from the state vaccine, and that those were the participating, and that was last weekend. So that is all the information that we received from the state with respect to the pharmacies.
So so in terms of, well, obviously the state, in order to be eligible, they would have to attempt to navigate the state website and things of that nature. But with respect to, again, the pharmacies, is there any specific direction that we're giving? Are we in Nassau County telling them to call our number? Are we telling them to check with the pharmacies, a combination thereof?
We're not, if they call our number, we're just giving them that information about that they need to call their local Walgreens, or these 4 Walgreens, and that they have access to the state system, and that's really all the information that the state has given us.
Okay, is it just the Walgreens, or other pharmacies participating?
Well, we were given information last weekend about these specific Walgreens, but there may be other pharmacies that are signing on to the program, but right now, that's all the information that we have.
And the pre-registering that the county is doing, can you explain again what the benefit of that for the
Well, we recognize that many of our seniors don't have computer skills. They're not, some of the site was problematic, and everyone seemed to be having some difficulty there. And so if you have a senior who's not savvy, or computer savvy, and can't navigate the website or even have an access to a computer or a smartphone to be able to do that, that represented a large number of our seniors. And so what we did, or what we were going to do and set out to do, was to take that, just get them on the phone and talk to them, and we do the registration on our end on their behalf. What we were doing actually were just taking their information, taking their name and information, and then when we get them to the site, we register them through our system that way, so that they would not have to worry about sitting down at a computer screen and trying to figure out how to get that done. We would take that on. So, but that was very short-lived because, as you stated, the state virtually prohibited us from continuing in that program, and so we had to stop. And so the last 600 we did by having our seniors actually get registered. We did a pre-registration for ourselves, but once they got to the site, that's when they were registered and able to be vaccinated.
You know, I understand you're doing your best to answer the question, and I think the limitations are not necessarily the result of the efforts you're making and the Department of Health are making, but it's clear to me that the issue here is with the state. I mean, that there has to be a better system for to getting these people the information that they need as to how to navigate the system, to make an appointment, where to go. It just seems like the directions are in flux, and these are for individuals who need very specific directions. So so I think, again, we need to refocus our attention on the state and advocate that the state do something better for our vulnerable populations. I know that they're making efforts in terms of many of our vulnerable populations, and we support that. And certainly, the communities that are affected to a greater degree should receive more resources, which is good. But in this specific area, I think it's, I don't think what we're doing is enough. Again, I don't know what we could do more at the county level, but New York State's got to change. I mean, they've got to make it easier. They've got to open up these vaccines. They have to make it easier for people to register. And so, I mean, we here in the legislature are going to make sure that we make our voices heard to get that done. I'm going to turn it over to other legislators, but I wanted another question for you or for the doctor. In terms of the new groups that the state is allowing counties to determine whether they will allow, I think it's taxi drivers, restaurant workers, and developmentally disabled. What's the county's plan for that? Are they going to is the county going to expand eligibility or not?
So I'm in the process of discussing with County Executive Curran and Chief Deputy County Executive Williams and Deputy County Executive Santoramo and Deputy County Executive Rose Lauder. We think that we're going to come out with formal policy on how to do it, but we understand that all of the essential workers in 1B are important, and we need to find a way to mitigate risk throughout all of our sectors. It certainly helps. You know, if restaurants, we want to see restaurants open. It helps if restaurant staff is vaccinated, that it can happen more safely, we think. So, we have tried to be fair with what we vaccinated. Last week, we made sure we've been doing a certain percentage of our vaccine each week for police and fire. We've made sure that we've gotten a bunch of grocery store workers who are essential workers vaccinated. We've gotten transit workers and nice bus drivers vaccinated. This week we're getting teachers vaccinated, and so I think we're going to come up with a fair means of making sure that all of the essential workers who are eligible are represented. Unfortunately, still our allotment this week was still the same 2,800 doses, which was the same as we had last week. And, 2,800 doses, we're getting 2,800 doses into arms easily. That's not a number that we can't handle. We certainly could ramp it up if we had to and would like to. But there are tens of thousands, maybe hundreds of thousands of eligible workers. So, eligible essential employees. So we're going to try and find a way as quickly as possible to get all represented groups vaccinated and come up with a plan on how to make sure the way we've gotten at least a certain percentage of transit workers and police and fire and that's across the county, not only county police, but local village police and volunteer fire departments and mass transit, nice bus, grocery store workers. We've hit a certain percentage of all of them, and we're going to try and incorporate everybody that we're responsible for vaccinating with the hope that more and more vaccine comes so it can speed up and that they also can be vaccinated in other segments besides just our pods.
Dr. Eisenstein, are you hearing from your conversations with state officials whether it's expected that the numbers of vaccines are going to increase? I mean, what are we looking at in the next few weeks, next few months?
Yeah, so last week the governor said that your allotment as a local health department this week is going to remain the same, and then they added a 16% increase for 3 weeks. So he said, so our number was 2,800. We were told to expect that for 3 weeks with a 16% increase. That 16% came to us in the form of 500 doses specifically assigned for us to use on OPWDD state facilities, Office of People with Developmental Disabilities, to make sure that we were reaching that vulnerable resident and staff population. So through the Office of Mental Health, Commissioner McCummings and Deputy County Executive Rose Latter, we're working with OPWDD providers with that 500 dose supplement, which is added onto the 2,800. We were told to expect the same numbers for 3 weeks, but then a couple of days after that, the governor said that 16% may go up to 20%. So I think numbers are starting to trickle up, but for the next couple of weeks, I don't anticipate a large increase to us. The other thing to consider is when more vaccine becomes available, it may not be allotted directly to us. More pharmacies may get it to come online. As Deputy County Executive Rose Lauder said, there are 4 specific Walgreens that already have vaccine this week. I assume, I don't know this is a fact, but I assume there's going to be others and other chains as well. We know CVS is part of the federal program to vaccinate. So I assume that as more vaccine becomes available, I hope some of it comes to us, but I assume more pharmacies are going to come online. I know the federally qualified health centers are eagerly awaiting vaccine. I know that private doctors' offices are eagerly awaiting. So as more comes to us, I don't know how much is going to come to the health department per se, but I was told to prepare for 3 weeks of a similar amount to what we have now, and that's since been increased to 16% and then 20% additional, but that is already designated for specific populations, and we're working at vaccinating them.
Okay. The other question I had actually from one of the residents who submitted a comment was, if someone receives a first shot and then becomes sick, what is the protocol? Apparently the information they were provided after the first dose was received did not specify. So if you become sick after receiving the first dose, what does that person do?
Absolutely, and I think that's a really important question because especially we've been given the Moderna vaccine, which is a great vaccine. It's 28 days between the first and second shot, and so people do still get sick. It does take approximately 10 days to 2 weeks for initial immunity, which is not complete immunity and not fully protective. And the literature is full of people who got the first dose and became sick within a couple of days or a week or two. Some of them were exposed before they were vaccinated. Some of them might have been exposed immediately after. It is not, I want to be clear, it is not related to getting the vaccine. The vaccine cannot get you sick. It is not alive. It does not cause living a virus. So it's just temporally related. We have a lot of disease in the community now and a lot of people being vaccinated. So if you get sick between the first and the second dose, the CDC offers that you wait 90 days because we know that there will be 90 days immunity, but you can get the second dose 10 days after the start of your symptoms or later if you have resolved. So we certainly will work with people to reschedule if they choose, and if, depending on when the timing is, they may not qualify for a second dose on the 28th day. And they may have to wait to the 40th or the 50th day. And so on individual cases, we've set up a means of responding to people with unique circumstances. I want to thank Jerry Giuliano, who's in the chamber with you, who's overseeing that effort for individuals who have an extreme circumstance, or they got called in, a police officer gets called into work on the 28th day and can't get a vaccine. So there's numerous circumstances where some people will have to be rescheduled. And if they contract disease between the first and second dose, it will require a medical evaluation as far as whether they should get it on the 28th day or they should wait. We know that after people are infected, they're immune for 90 days. So the CDC has offered you can wait 90 days. And that's true for the first shot, too. You can't, if we've had people come in for vaccine and they just were infected in the last 4 or 6 weeks. If it's more than 10 days out, it's not contraindicated to give them the shot, but they also are presumed immune for 90 days. So we would want them to get the shot when it's most effective for them, as well as if they're already immune, we'd like to see the shot go to people who are not immune, but it's not a contraindication as long as they're 10 days out and recovered from symptoms. So the same is true for first and second shot, whether people get COVID before the first shot or between the first and second shot. But at each of our pods, we have a medical consultant, and certainly they can call their provider ahead of time for guidance.
Legislators, and the legislator from Ready had a question. Anyone else?
Thank you, Presiding Officer. Hello, Dr. Eisenstein, Jerry, Ms. Raslauder. I want to echo what the Presiding Officer said just about the Department of Health and what a fantastic job you've all done. Dr. Eisenstein, thank you for everything you've done. I know you've all been available to us 24/7, and your response has really been outstanding, as always. So thank you for for that. Just some numbers I want to confirm, because I have some numbers here that indicate that approximately 288,000 doses have been received in the Long Island region. Is that roughly accurate?
So the total vaccination process for the Long Island region, Long Island has been designated as one of the state's hub regions. The hub is being coordinated by Northwell Health. So I don't know what the total that has been distributed in Long Island is. Northwell coordinates that. I know what's allotted to me, and certainly I'm on the hub calls with Northwell, but I'm not sure exactly how much has come to Long Island as a whole.
All right, so I'm giving you numbers from the states that were given to us by the state. So
yep.
What we're showing is 288,000 doses, approximately 2.7 million people are in the Long Island region. That's the population. Now, in New York City, there's been approximately 1,041,000 doses, again, according to the state information, and they have a population of approximately 8.4 million. Now, the vaccine to resident ratio in Long Island is 10.6%, and the vaccine to resident ratio in New York City is 12.4%. This is a number that's somewhat troubling to me in light of the fact that the Long Island region right now has the highest infection rate. So my question is, and maybe this is a question for Ms. Raslauder, what, if anything, is the administration, specifically the county executive, doing to advocate for more equity here in the state distribution of the vaccine?
So I would say that I am on hub calls with Northwell, and when we have seen a gap, like I described last week, that I felt there was no vaccine coming to seniors, County Executive Curran got right on the phone with me, speaking with the Executive Chamber in Albany, excellently got us 600 extra doses for seniors last week. I understand 600 doses is not sufficient, anywhere remotely sufficient, but it was 600 more than we had been allotted. So I think, and I have been on the hub calls with Northwell, who is the coordinating body. We have also been on NISAC calls with New York State Association of Counties, advocating for our fair share. And I think I am on the call with the State Health Department almost every single day, bringing up the numbers, bringing up our population, and with the understanding, being the neighbor to New York City, that there's always, being the neighbor to New York City always presents public health interesting scenarios related to being on the border. We share an open border with New York City, so I think we have advocated. We've spoken with the governor's office multiple times, and the county executive, every time I've identified an opportunity, has joined me and has been great in joining me with this. Certainly, I want us to have our fair share, and even more than that, if I can get it. So, you know, on my end, what I could say is I'm advocating relentlessly for our residents. Sometimes it has worked in getting us supplemental vaccine, and I feel fully supported by the County Executive Curran in doing that. And but do I want to see New York City get more than us? Absolutely not. I want us to have our fair share. I fully agree with you.
Well, Dr. Eisenstein, I appreciate that, and I want to reiterate, I think you're doing a great job at overseeing the administration of the vaccine that we're in possession of. You know, but what I'm asking, and I'm glad to see that Deputy County Executive Rose Latter is here, someone, you know, that works so closely with the county executive, because my question is more towards what exactly, specifically, the county executive is doing. You know, I see that she has seems to have a good relationship with the governor when she, you know, requests certain executive orders. They seem to get done, to her credit. You know, when we had the recent assessment debacle with the veterans exemption, she asked for an extension of the due date of the tax bills, and it got done. So I think that's a good thing. So since that relationship exists, you know, I'm just curious to know what specifically the county executive has done, and I would ask Deputy County Executive Rose Latter, maybe she could explain, you know, to advocate for this vaccine. 600 extra doses is wonderful. Obviously, we should take every single dose we can get our hands on, but that doesn't change the fact that the percentages are showing, the numbers are showing, that a disproportionate amount of vaccines are going to an area that has a lower infection rate. And, you know, you could say, I'm sure many of us on this dais have severe disagreements with Mayor de Blasio on many issues. But you have to give him credit for being out there and advocating to the governor, directly taking him on. And, you know, we see the results. His area is getting a disproportionate amount of the vaccine. So my question is, you know, what is the county executive doing to make this right?
Well, I can assure you that the county executive is doing everything that she can to get as much vaccine for our residents as possible. That means that she is on the phone with the state, as Dr. Eisenstein indicated, daily, explaining to the state what's happening here on Long Island, what our needs are, the capacity that we have through the Department of Health to do the job, and that has resulted in us getting the additional doses that we have been allotted up to date. So it is a strong advocacy. She's been relentless with it, and it's a daily effort. It's a daily push. It's unfortunate that this is not something that is controlled. Obviously, the city gets a lot of attention. They were greatly impacted, and the way that the living environment of the city poses a particular challenge, and so there's a lot of fear with respect to how they live and the ability for the numbers to skyrocket there overnight. So that may be factoring. I don't know. It's a speculation as to why they are getting more, and also obviously the positivity rate fluctuates, so that is a factor. So, but I can tell you that the county executive is doing everything that she can possibly do in terms of advocating for every resident to get more vaccine. It is a paramount concern of hers, and it's in the forefront of everything that we're doing right now. So the push is there. There's no backsliding there or not stepping up to the plate and getting it done. That's something that she's doing every day. And
Let me ask you, you may have recently seen that the majority held a press conference calling publicly on the mayor to stop the policy in New York City of keeping Nassau and other non-New York City residents out of the city-run vaccination sites. Has the county executive made any public comment or issued a statement joining us in demanding that the New York City mayor allow Nassau residents to be vaccinated at these sites?
to my knowledge, she has not.
So when you say she's done everything that she can, how about she does that? Because that's another avenue. We have these vaccines, a disproportionate amount, that are being sent to New York City, and we can't get them. We're legally allowed to, and the mayor is not allowing our residents, our seniors, our veterans to do it. And yet the county executive has not joined us in demanding that he follow the policies of the federal government and allow our residents. So I understand, and I appreciate your response, that she's stepping up to the plate and she's doing her best. I don't see it, and I don't think that the residents of Nassau County see it. And the residents are demanding results, not phone calls. They want results. And when you're telling me she's doing everything she can, I mean, this is a slam dunk. The mayor has to let our residents into New York City at those city-run facilities and get vaccinations, and I would hope, you know, that she would join us in demanding that.
Well, I will take that back to her, and I'm sure she will consider it strongly. I know that we have not been exclusive in our pods, and we have admitted residents from all over the state, from all the boroughs, and that's what we've been doing. And up to this most recent effort by the mayor, our residents have been welcomed there too. So that is a change in circumstance, and I'm sure the county executive will consider the legislative's move and consider whether she wants to speak on that as well.
And I think we're following the guidelines. We're allowing residents to, you know, that are not Nassau residents to come to our sites. I'm not being critical of that, but you have to recognize, and the county executive needs to recognize, the inequity here, where a larger portion of the vaccine is going to New York City, and we can't use those sites. A smaller portion of the vaccine is coming to Nassau, and they can use ours. So there's a large inequity here, and when you see all these emails of seniors, and not even seniors, people emailing on behalf of their senior parents, grandparents, with real worry and real concern, they need results. They demand results. And so saying you're doing everything you can, and I know this isn't you, you're just relaying the message. When, you know, we had a press conference asking for her to join us, and she hasn't, it's discouraging. And I hope that she, you know, demands results from the governor. And this will be one of the few times I would say mirror what the mayor is doing in taking the governor on if he's not going to produce results and make sure it gets done. So thank you.
Just Dr. Eisenstein, how long do you have for this?
I got about another 15 minutes or so, and then I'm going to get to the pod.
Okay. Why don't we, for the next 15 minutes, direct our questions at Dr. Eisenstein, and then once that's finished, we can then resume with the Deputy County Executive. I believe we have Legislator Rhodes, Bino, Walker, and Drucker in that order, and then whoever else after that, you and Kennedy.
Thank you, Mr. Presiding Officer, and I do have several questions for the administration, which I'll hold. Really aren't directed to Dr. Eisenstein, but I will ask Dr. Eisenstein, and again, and not to sort of beat the dead horse, but I do want to compliment the Department of Health, and I want to compliment you personally on the work that you've done. It has been, and your department has done, it's been absolutely tremendous, taking what has been a mess of the state's rollout of the vaccine and trying to turn it into, with very confusing guidance, a workable effort on behalf of Nassau County residents, and I certainly appreciate that. One of the frustrations that many residents have mentioned is the fact that, for example, residents who happen to have underlying health conditions were approved by the governor to receive the vaccine over a month ago. Yet the state hasn't issued any guidance with respect to an underlying health, what underlying health conditions qualify them to receive the vaccine. So as a result, even though they're eligible, no one has been able to sign up for an appointment either at a Nassau County site or at any of the state sites due to the absence of criteria from the governor. Have there been any communications between our health department and either the governor's office or the state health department with respect to that guidance, and what seems to be the delay?
Absolutely. That's, that came up each week. The governor does a press conference where he mentions who's going to become eligible for the following week. There was a few weeks back, 3 or 4 weeks ago, where he said, I'm adding certain populations, including immune-compromised populations, but the guidance defining that never came forth, and that's been put on hold. When I'm on my calls with all the other county health commissioners and directors around the state, that's a topic that comes up every single call. We're waiting for that guidance. We understand that immunocompromised population is an at-risk population, and it's something that I am advocating for, but as of now, I do not have an answer for you.
And so we've been given no indication as to when that guidance is going to be forthcoming?
No, but we're pushing strongly for it because I agree with you that that is a vulnerable population, and I think, I've myself at the pods, and I'm there. I'm doing some vaccines myself. I'm the medical consultant on the pods a lot of the times, and I have people, I speak with them face to face, and I hear their stories, and I sympathize, and I get it. And I wish I had the answer as to who in the immune-compromised categories qualified, what conditions are considered for a vaccine. As soon as it is, we'll incorporate them if it's us who's allowed to vaccinate them. But I have advocated strongly on behalf of this, and the answer we typically get is it's a matter of supply and demand. As soon as there's enough vaccine to reach more populations, they'll release it to us. But so to answer your question, yes, I have advocated strongly with the state on this. I think it's important, but unfortunately I don't have the specific answer of conditions yet, and we are not allowed, that is not an eligible criteria right now, immune compromised.
Well, I guess part of the frustration is what the presiding officer alluded to before. You mentioned, and it's great that the state recognizes the fact that they only want to make additional people eligible and issue additional guidance if they have the vaccine to be able to provide it. But, isn't it true, Commissioner, that at this point, probably somewhere in the area of around 900,000 out of the county's 1.4 million population has been 1.3 and change million population is eligible for the vaccine, yet we're only receiving 2,800 doses a week. The math just doesn't work. Is there an explanation from the state as to why so many people have been made eligible for the vaccine when there is no vaccine supply to accommodate that population? It does simply lead to confusion and frustration and aggravation on the part of many residents, and only heightens their fears being eligible for something and not being able to get it.
So there's no doubt that there are hundreds of thousands of eligible residents in Nassau County, and it's frustrating for us that I only have 2,800 doses, knowing that, we've had days where we've made the link online for appointments available, and 600 or 700 doses have gone in under 2 minutes. And, I'm out in front of the press with County Executive Curran, and we keep saying the same message: get us more vaccine and we'll get it into more arms. But absolutely, 2,800 supply for us is not going to meet the demand right now of hundreds of thousands of people. So I agree with you.
And I do have a question there's several questions from residents, and I just want to cover one or two of them. The question is, if wedding attendees can take a COVID test to attend an event, why can't a family member do the same to visit a loved one in a hospital or a nursing home?
So the governor just mentioned that that's going to be a requirement when catering halls are open for weddings in the middle of March. The guidance on how that's going to work or what the requirement is has not come out yet. So it may be when that comes out that there's that kind of allotment. And I think we're also going to have to reevaluate as more people are vaccinated, you know, what's going to be the requirement for them to attend an event as they're considered immune. But the science is still not finalized on their ability to transmit, although I think it's unlikely, because that's typically how respiratory viruses work. So it's a fair question, but the guidance even on weddings, and is weddings other parties as well? Is it bar and bat mitzvahs? Is it sweet 16s? Is it just big corporate gatherings? We don't know what that's going to entail yet, and so that question may be answered in the guidance that comes.
Well, specifically with respect to, and look, I mean, obviously the problems that the governor's guidance has visited upon nursing homes is well documented. You know, certainly what occurred in the early part of the spring, and now with the information that the numbers may have been purposely underreported. I've gotten several comments and questions specifically about the ability to be able to visit residents inside of nursing homes. You know, as I indicated, my own, you know, in a private conversation, my own grandmother passed away in a nursing home from COVID right at the start of the pandemic, and you know, we weren't able to visit, we weren't able to, you know, there was no funeral, there was no wake, there was nothing. People want to be able to get in to see their relatives. If they have a test, if they've been vaccinated, is there any indication on the part of the governor as to whether or not they're going to be permitted to visit their relatives who they haven't been able to see basically since March?
I think it's a fair question. I think the role that testing is going to play in allowing a lot of aspects of society to open up, I think they're working on that as I'm reading the tea leaves, but I have not gotten any specifics on that yet. So I think we'll hopefully see guidance along those lines in the next few weeks, but I'm not sure. And to answer the question, no, I don't know of any specific mechanism yet regarding that kind of visitation and how testing might work.
Now, I know your time is limited, and I know other legislators have questions specifically for you, so I'm going to defer the remainder of my questions, but I do just have one last one. You, by specialty for residents that don't know, are an epidemiologist. In private practice, you were an infectious disease doctor. That was your specialty, correct?
I am board certified infectious disease specialist still, but I'm not in practice because I'm your commissioner.
And thank God you were the perfect man in the perfect place for this particular pandemic for Nassau County, and we appreciate everything that you've done. Based on your knowledge and expertise, has the state ever bothered to consult with you as far as, or any other doctors that you're aware of on a local level in our individual health departments as to how this vaccine distribution system was going to be set up, as far as what guidance is going to be issued, as far as how any of the pandemic was going to be handled? So, or is everything coming out of the executive chamber, you know, essentially however they decide to do it?
So, to answer your question, nobody has consulted with me specifically based on my expertise as an infectious disease specialist. I am on calls with the State Health Department virtually multiple times a week, where I am also the chair of the New York State Association of County Health Officials Disease Control Committee, because I am, I think, the only infectious disease doctor who's a commissioner or a director of health in all of New York State. So I am the chair of that. I do get to speak with the State Health Department, make our concerns heard, make our questions asked. We sometimes get answers, sometimes we don't. So my line of command is up through the State Health Department. They hear our concerns and questions. Once those calls end, I assume they go up to chamber. I don't know where they go through Albany's pathway, but has anybody reached out to me specific to my infectious disease expertise? No.
So no one from the governor's office has ever been in contact with you?
Well, we've been in contact, but not particular to me being an infectious disease specialist.
No one from the governor's office has consulted with you, I guess I should. based on
no.
your expertise. All right, thanks. I have no other questions for Dr. Eisenstein, but I'll reserve.
Okay. Legislator Bino has questions for the administration, but not for Dr. Eisenstein at this moment, so we will come back to her. Legislator Walker for Dr. Eisenstein.
Yes, Dr. Eisenstein, too, I know we say it over and over, but I want to thank you, and I thank all your staff and all the volunteers for the excellent job you are doing. And we try to make our residents realize, too, that you are doing everything possible that you can, but unfortunately, your hands are tied, and, you know, you have to follow the guidelines that the state is setting up as far as who you give the vaccines to, certainly the number of vaccines we have, and so on and so forth. So, again, thank you to all of you. Have you and the other health departments throughout the state, you know, like you said before, this is something that you are prepared for, that you have a plan for, that, you know, especially vaccinations and so on and so forth, and yet you kind of weren't reached out to get any of your expertise and or let you take the lead in that, and in the fact that you know what you are supposed to be doing. Have you all reached out to the state and to the governor and saying, you know, like what happened here? Like, why all of a sudden did you have to be the king here and do what you set out to do and kind of leave us out of the picture when we've been prepared to do this all along?
So I am on the board of directors of the New York State Association of County Health Officials. I was the president a few years back. I also am the Disease Control Committee chairman, and so that's the association of all the health directors and commissioners of every county in New York State. We have an executive director who communicates with the state health department and executive chamber on our behalf because there are 63 different counties. We speak with the state health department frequently. Once in a while, executive chamber does join the calls. We have sent our concerns on numerous issues, as we do with any topic, and make our recommendations, ask our questions, and so I have both advocated individually and through the association of our concerns, our recommendations. We've been asked why we're at the sites that we're at for our pods, and that's because those are our pre-approved planned sites where we've done drills that we know work because they're pre-approved by the state. And so, we're at Nassau Community College, we're at the Yes We Can Center. Those are locations 1 and 2 on our pandemic plan. We've done drills in those locations. We've held pods in those locations. After Superstorm Sandy, if you remember, the special needs shelter that the health department ran was at Nassau Community College in the same room that we're giving vaccines now. So we follow our plans. The hub designation was something new for us, that Northwell was going to be the coordinating factor. Now, we have a great relationship with Northwell. We're in communication with them. They've been a great partner. They've helped us when we've needed help in all kinds of ways. But that was something new to us, so we adjusted it. We asked our questions, but I don't have a direct line to the executive chamber. There is also for the county a control room call that we have in the administration, a control room representative that speaks with one of the governor's representatives to talk about not necessarily health-related issues, but any COVID-related issues, ranging from, what are the local business requirements and that sort of thing. So there's a group that was put together. Those calls happen frequently. So I take the health route through my health lanes, and there's a control room call for administrators to speak. And so we do the best we can, but I don't have a direct line to, for example, the executive chamber. But my concerns and letters do get there, I believe.
Well, as I stated to you before in many of our phone calls, I wish you were the man in charge, because I think things would have been rolled out a lot differently and certainly a lot better. And I know that we have emphasized this, and you certainly, when you were able to give the vaccines to our seniors. I mean, I was at the pods. Pods are amazing, doing a great job there. And to see our seniors there, I mean, literally crying because they're so happy they're able to get the vaccine.
Yeah, it does.
Unfortunately, we get the phone calls too from those crying or their children crying, and the fact that they aren't able to get an appointment, they can't set something up. We have senior housing, that if we could do something there to, bring in the vaccine to them, that they could all be vaccinated right there at their senior housing complexes. I know we did that with nursing homes, not the county, but, whether it was pharmacies or whatever. But anything that we can do to, most of the emails that we have gotten, phone calls we have gotten are in regards to the senior population, some who don't even have internet capacity or don't really know how to utilize it to get an appointment. I've also had some questions from people who are a single parent, they lost their husband or they're raising their children on their own, or lost their wife and raising their children on their own. And they are very, very concerned because although they might be younger and don't fall into any of those categories yet, they're the sole providers and the sole person taking care of these young children, and they're very frightened because they feel like they're so far down the list to be able to even, be eligible to get a vaccine. And of course, they've reached out to see what can be done for them. I know I spoke to you yesterday too about now that we have sports beginning back in our schools, which is wonderful for all those playing sports and hopefully doing the right thing. Now reached out about what about our officials that don't fall into any other category. They are looking to be able to get the vaccine because they will be working closely with our children. So I don't want to hold you up. You have to get to your pod. But thank you again for everything you're doing, and anything that we can assist you with, we will certainly keep reaching out to the state to do what's right for all of our residents here in Nassau County who deserve everything that they should be able to get. And again, you're not holding it up, but in many ways the state isn't doing the right thing by our residents.
Okay,
Thank you.
Yeah, and I want to thank you. And the officials thing is something I always appreciate feedback from the legislature. That's the sort of thing that I immediately took up because in all of my work, that's something, in thinking about it, that we need to advocate for. You're absolutely right. And I appreciate the support. It's great that you and some of the other legislators came to visit us. It's great for morale for my staff and our Medical Reserve Corps volunteers, who I have to thank, that are volunteering their time. Many of the people vaccinating on many days, the majority of the vaccinators themselves are doctors and nurses donating their time to do it. It's very rewarding work. And I do have to reiterate, when I do feel that there's something that we need to address, I feel very supported by the administration. They're always backing me. They're always giving me, county executive and I are out in front of the press and trying to get as many needles into arms as we can. And like I've said, 2,800 is a frustrating low number for us, but I do feel very supported by the county executive. I feel supported by the legislature. I'm very appreciative for the staff and the Medical Reserve Corps. And I have time for one more question, Presiding Officer, then I got to run.
Okay, Legislator Trucker.
Thank you, Presiding Officer, and I'll echo the sentiments of all of my colleagues here. Dr. Eisenstein, it's been about a year now that you have been front and center during this pandemic, from the early stages and throughout the summer, and now with the vaccination process, you've been there too, and always a great resource to the legislative staff and us, legislators, and everyone else. So I want to thank you also.
Thank you.
I think the consensus today is clear that the problems that we've been having are really emanating from the state of New York, and perhaps, Presiding Officer, we could have asked someone from the State Department of Health to come down today and answer a lot of questions that we have. I think that would have been very helpful too, since it's clear that the county is beholden to the state on these issues. But I just have one question, because a lot of the questions have been asked, Dr. Eisenstein. If you had to identify one area or an area of the distribution process that was flawed, or what, if anything, would you have done differently in getting the vaccines into people's arms?
That is a complicated question, but I think that I would love to have some time to mull that over, because we do running hot washes, which is reviews of what's gone well and what can be improved. I think the single most important thing that has been difficult for us is we haven't had an electronic system that has helped us with things like, so for example, when we were able to make appointments online, the system would keep crashing in the middle of the day. That slowed the pods down. It made it frustrating for people to get appointments. They would go on, they would see an appointment available, they'd click the button, and before they could finish their registration, the system would go down. And that's something that is being done statewide. So a local system would have had to be created, and our IT group, I want to thank them. They've been incredible working with us around the clock. They are in the middle of creating an electronic platform for us where we will fully be able to make appointments and schedule and send reminder emails and schedule second dosing. But the system that we were originally given, every shot that we give has to be registered through the state system called NICES. That's the New York State Immunization Registry. And that's the law, that every shot. So our system has to be eligible to enter into theirs. So electronically, it's been frustrating because we've been reliant on a different system that has had numerous issues. It has caused people a lot of frustration. And it's not something we could plan ahead of time because we didn't know what our role in this was going to be. So now that we do, and we're only, still vaccinating less than a month. And I think that's really important. Our first doses that the health department gave were on January 5th. So it's been less than a month. The strides that we've taken from an IT and a operational standpoint as far as dealing with the situation that we have in front of us, amending our plans to work in all of these components, to accept that the hub is overseeing vaccine distribution, and we're part of that process. All of these things have happened. It's still less than a month. It's only February 4th. Tomorrow will be a month since we gave our first dose. But I think the piece that has, obviously, the thing that would have been great is if there was just more vaccine for us. That would be the easy thing for me to say. I wish we had more vaccine. That is absolutely, without a doubt, the answer. I wish we had more vaccine. But I think your question was deeper than that. We've talked about that, numerous times already today. I think from us having an IT infrastructure, a program in place that would have been less difficult for the public was something that might have been helpful. But thanks to our IT internally, and again, I got the resources I needed from my boss, the county executive, and now I think going forward in the near future, that's going to be rectified. And as more vaccine becomes available, I think there will be much more of a friendly, customer satisfying experience for Nassau County residents as they try and get appointments and second dose appointments. Second dose appointments are going great already, and that's because of our own in-house IT team, so I have to thank them. So I would like more time to mull over that question as to if I could fix one thing, but definitely the one thing I would fix immediately is if there was just more vaccine, of course. But I know everybody feels that way. For me, operationally, it would be a smoother IT component because people have been frustrated, and you're right. And it's equally frustrating for us when we've got a line of people to vaccinate and a full army of vaccinators, but the system crashes and we then have to pull out the paper and do it all on paper rather than just click go on the computer, give a vaccine and let the person move on. We have to write all the information in when the system crashes and put it in later. So those are the kinds of delays. Although it doesn't happen that often, when it does, it backs things up and it's much more of an efficiency strain on us. So that's, I think, what I would say right now, but I would love more time to reevaluate my answer to that question.
Sure, that's sure. Thank you. I mean, so is it fair to say, Dr. Eisenstein, that your discretion, your authority in the distribution process is limited or controlled by the state or the federal government and hampered in that way?
So we've been given an assignment as to who we can vaccinate. We've been given a limit as to how much vaccine we're getting, and we find out on the weekend for the following week. So there have been days where our vaccine has arrived Tuesday in the morning and Tuesday by noon they're being used. And we were limited to the state's IT system, which we are now developing our own internally, and that process has been great. But as far as operating our pods, we're following our plan. It's one of the most important things that, we teach in emergency preparedness is you have a plan. You have to tweak it based on unforeseen circumstances, but we communicate with the hub at Northwell. We're part of a greater operation, which is the hub region vaccinating all of Long Island. We're just a piece of that. Once we get our assignment as to who we can vaccinate, once we get the allotment of vaccine, I think we've been judicious, we've been fast, and we've been efficient in getting our full allotment of vaccine into a full allotment of eligible recipients, and we have prioritized and we've done it fairly so that every sector has gotten a percentage of it. So yes, we are limited as far as, do I like the idea right now that we can't vaccinate seniors? No, I've said it to you as the legislature probably 100 times since this started a year ago. They are the most vulnerable population. That's not assigned to us right now. Would I like to be able to vaccinate seniors? Yes. It's very uncomfortable for me when I'm at a pod and I'm vaccinating somebody who's telling me about their senior parents and I'm unable to vaccinate them. But we have to attest legally that we're vaccinating who we're eligible to vaccinate to. But as far as the actual operations of running our pods, once you take all of the factors out that we have no control over, I feel that my staff has operated almost perfectly. We've followed our plan. The pods are going great. I can't tell you, I spend a lot of time just speaking with our residents who come, and so many of them say, wow, I've heard so many horror stories. This is totally different. Yes, it's totally different because this is what we do. This is why you have a health department. It's unfortunate that for a health department, our time to shine always seems to be when something terrible is happening. But I do want the legislature to rest assured we are prepared for this. We were prepared for this. We've been going 7 days a week around the clock since February. Our call center, there are days our call center has taken many, many thousands of calls. They were open on Christmas, on New Year's, on Thanksgiving. That's because my workforce is willing to do it. It's life-saving work. So within the parameter, all we can control is how we do with the parameters that we're given. Within those parameters, I think it's been an amazing response. And it's a credit to the staff and to the Medical Reserve Corps and the leadership who's given me all the support that I can. So thank you again to the county executive and all of you for your support. Are there things out of my control that I'd like to see different? Of course. But
in your
I
opinion,
also do want to thank Northwell. They've been a great partner, and I'm in communication with them every day, too.
In your opinion, Doctor, has the county executive done all that she can to advocate for and protect our most vulnerable population?
Absolutely, and she is always accessible to me, 24 hours, 7 days a week. And for somebody in my position, that's the most important thing. When I need to speak with my boss or I need something, that they're available. And all of the Deputy County Executives, Deputy County Executive Santaramo, Deputy County Executive Rose Lauder, who's there, and the Chief Deputy County Executive Williams, and the County Executive herself, we are communicating multiple times every day, multiple times. It's basically one long ongoing conversation, and I've always felt that when I need to get a message through, it is immediate when I call. And I also appreciate that they consult me. They ask me my medical expertise, my opinion, and it's nice to work in a place where I feel so supported during what has been for everybody a very difficult time. So I am very comfortable, and I feel the same way about the legislature too. It's a pleasure for me to be on the calls with you. I don't always have the perfect answer, but I think that the communication has been really good, and many of you call me, you know that. I try and be accessible to everybody. Sometimes it takes a little while for me to get back to you, especially if I'm actually vaccinating. I don't keep the phone right up there on the table. But so I want to thank you all as well. And for as difficult as this has been, for me, feeling supported by my boss and everybody around me, that has not been a problem.
Thank you very much, Doctor.
Thank you. And I'm going to run to the pod now and say thank you very much. And that certainly any follow-up questions, we'll have more chance to discuss.
Thank you, Dr. Eisenstein. And
Thank
get to
you.
this pod safely.
Thank you.
Okay, Legislator Bino?
Thank you, Legislator Walker. Good morning. How are you? Good. Thank you. So I would have liked to thank Dr. Larry for all that he's done, but in the interest of time, I'll make those accolades in his absence. I wanted everyone who had a direct question for him to be able to speak. But I am very, very, very thankful for his service during this time, from handling the initial, pandemic to now trying to get to the recovery piece of it, where we're doing the vaccinations. I had the opportunity to visit a pod over at the Yes We Can Center, and it does run very smoothly, and the process is guided by many that are volunteering, strict volunteers, and then you have people who are volunteering from other departments that are there. So I'd like to thank also the commissioners of Department of Social Services, as well as Department of Human Services. I know that I've seen Commissioner McCummings at that site as well. So I want to start first by thanking the county and thanking the county executives team for some of the work that was done in an effort to ensure access for our most vulnerable populations. Very early on, I was very cognizant of the fact, I'm going to take this off, very cognizant of the fact that seniors would have a problem utilizing the website. So I made the call over to Chief Deputy County Executive Helena Williams and requested a meeting. And I believe you were on the call. I know Dr. Larry was, and there were a few other folks on the call. And that's when we talked about there needing to be a call center here, locally here at the county. And I also had concerns about how we would even notify people living in public housing and the like, and if we could go to those sites and put the needle in the arm. And immediately, there were a lot of different ideas that were coming, that were being put forward on the phone. And I would commend you because the county, because there was, and you could see there was a willingness there. We talked about going to the different sites, and Dr. Larry talked about how incredibly challenging that would be to go to the different senior centers or to even the Housing Authority's senior housing locations, and talked about getting a centralized spot. And I said, well, transportation will be an issue. Can we contact Nice Bus? And it was, everything was yes, 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 let's do this. And I think probably one of the more impactful things that we were able to do was to set up the phone line, because I said the seniors can't navigate this. They're going to need help. And immediately, Helena Williams said, we're going to set this up. We're going to get a phone line. And she explained to me how she would do it, and that it would be departments, different departments throughout the county that would be a part of this phone tree. And so folks sitting in Office of Minority Affairs, Hispanic Affairs, the Health Center, Aging, will get these calls sitting at their desk. And so I said, perfect, that will work. I think I can't remember, but I think the call was like on a Tuesday. I want to say maybe January 10th or something, or 11th or whatever it was. And by the next day, I had the phone number. By the next day, the phone number was set up, and it was going to go live within the next, I think by the following Monday. And we were going to be able to take these soft registrations, over the phone. And community organizations, local mayors, everybody was going to be a part of getting these names and getting them over to the center so the folks could make the call and register the folks. And it was working. It was working very well. Disappointing to me that we came across a barrier that was not of our own making, of the state, that by their directive that we could not vaccinate seniors. And so it was incredibly disappointing for me because representing the Westbury Newcastle community, Newcastle having a pod in its backyard, and I stated when it was opened, when we had the press conference to make sure that the larger community knew about this pod, that I thought it was great that we came right in the backyard of frontline workers and that we were going to vaccinate some of the most impacted members of our community and be able to give them vaccinations. And not lost on me is just across the street from the Yes We Can Center are 2 senior developments. You have Magnolia Gardens with about 91 units. It's public housing. Right next door to it, you have a low-income tax credit property. I think 77 units, newly built, 77 residents that live there, or more than that, 77 units there. That being said, we are now, what's troubling me is that the state has created this situation where the folks who live in those buildings who did not get the shot in the immediate week or so are now going to have to travel. They're going to have to travel to the nearest location to them now is in East Meadow, okay? And they're going to have to travel, if they have a car or have the ability to be transported by vehicle, direct vehicle is going to take them 9 minutes to get there. While they're sitting there, looking at this pod, looking at people coming from all over Nassau County getting vaccinated, and they're shut out. So, and those who don't have a car now have to travel 50 minutes by public transportation, if they're physically able to do so, to travel to get the shot. So this is incredibly troubling for me, as it is for all my colleagues here who are representing their communities and have these heartbreaking stories of seniors who can't get a vaccination. And so they can't get it for a multitude of different reasons, right, that I've just laid out. Technology is not always, afforded to them, okay? And if they do have it, it's not an easy site to navigate. And then transportation would be the other piece, right? So I am troubled about how the state has rolled this out. I really, really would like to see a considerable amount of pressure put on the state to allow us to localize a plan for how we can distribute the vaccine in a way that meets the needs of our communities that we serve. I am concerned that we're going to shut people out from being able to get this vaccine while they're looking at pods. The Nassau Community College, it's right across the street from Uniondale, from some of the folks that wanted another highly impacted community. What kind of access do they have to that site? We're going to have to put the pressure on the state to understand what our concerns are, what our shortcomings are here, and our inability to meet the needs of the folks that we serve directly. I really do think we have to do that. So I'm going to ask a couple of questions, but I did want to start out by thanking you guys, thanking the county, because I do believe the willingness was there, and but we've been handicapped. So one of my first questions is, does the state even provide the county a list of the pop-up pods that they're going to have? And moreover, do they provide you with a list of these pharmacies that actually have the shots so that we can then communicate directly to our residents where they can go and get the shot? Because I happen to come upon the 4 sites on Facebook. That's how I learned about the 4 sites. Is the state providing you a list at all of these sites that they are providing the vaccine?
Good afternoon. Actually, still morning. Thank you. We were on a statewide conference call, I believe it was on Sunday, where they told us that The Walgreens was going to start rolling out some of these outfits, and there were going to be 4 sites. I don't believe they specifically mentioned it on that call. I do know that they were going to send out to the public health directors and commissioners more information on that. That's not something that I received, but they were looking to send out some more information as to where these specific sites were. So,
Okay, I think we have to communicate to the state that we're going to need that information. If they're not going to let us vaccinate our seniors, then they need to give us the information so that we can provide it to the seniors.
Okay.
And then I honestly think that they should be setting aside and allowing us a certain allocation for just seniors every week. You know, I don't care if it's, you know, they gave us 600 last week. We'll give us 20% of the allocation that comes down, you know, on a weekly basis and allow us to vaccinate seniors. Or those, and I would go further, that when we open up for those that have underlying conditions, also be considered in that same pool. Because we know that they may also have trouble transporting. I think the governor's done a wonderful job, you know, in dealing with the pandemic. I think in this particular aspect, he's got to give us the freedom to localize a little bit, okay? So I think asking for that a certain percentage of the allocation to be granted to those populations would be extremely helpful. And then I'm going to go a step further and request that the county consider keeping up that senior phone line that was created, just so that they can help seniors who don't have computers, people who might be visually impaired, to be able to register to get the shot. Although, you know, it's not of our doing that they can't come to us, but we can still help them get to the Walgreens or the state sites by providing that service. I think that it would be extremely helpful.
So I can tell you that this county has done more vaccinations. We've done more vaccinations in this state than any non-hospital entity has done. And because of that, and because we've been able to get more than 100% of the doses into arms by utilizing that extra dose that's sometimes available, the state did give us, we were able to wrangle out, I should say the health commissioner and the administration were able to wrangle out those extra 600 doses that we did get for earlier on to do the seniors, and I know they continue to fight for that, so we're going to continue to fight for that. We did so well, they were all willing to allow us to continue to get some extra senior doses, but we will continue that fight. I know they're doing that on basically an everyday basis for seniors. With respect to those who are immunocompromised and others, we know it was mentioned on one of the governor's briefings. We have been looking and waiting to see guidance officially come down from the state on that, and it hasn't, and we continue to wait and watch, and we will continue to ask when we might be able to expect that.
Okay, and again, my frustration is really, it's directed at, you know, the folks that are managing this process, and I know it's not Nassau County. I again applaud you, and, you know, my passion comes from the frustration that I'm experiencing in trying to help the seniors. You know, I was in Stop and Shop the other day, and I was like shocked that folks were just coming around me. They wanted vaccinations, and it was overwhelming. But I was pleased too, because we do know that we face, you know, a challenge where certain portions of the population don't want the vaccine. But here I was being confronted with folks who wanted the vaccine, and I can't get it to them. One woman has an appointment up in March up in Binghamton to get the vaccination. People are willing to travel to get it. We've got to do the very best that we can get the state to hear us. I've actually contacted some of the state task force members, the folks on the social equity task force, and spoken to them directly too about what our needs are here. And they are advocating because they get it. They live here. They live locally. So they're in alignment with what we'd like to do here. But yeah, it is frustrating. And then my next question is about teachers, right? We saw that whole districts were getting this opportunity to get vaccinated. My phone was blowing up from locals. It was ringing from local superintendents saying, you know, how can we get our teachers vaccinated? We're serving, you know, the most impacted communities, and we're closing schools on a regular basis because our teachers are coming to, you know, are getting tested and coming up positive for COVID. I applaud the county again because I know you went, I think you did Sewanaka. I know you worked with me to help get Hempstead and also to get some vaccinations in the arms of teachers and faculty in Westbury and Hempstead as well. So is there a plan for moving forward with teachers? Because Dr. Larry just said today that teachers are the priority this week. Is there a plan to try and help other school districts be able to have the opportunity to get the shot in the arm?
So, yes, and I can answer that because we're happy to say that starting actually yesterday and going through Monday, we have set up links for teachers for public schools and non-public schools, and not just the teachers, for the paraprofessionals, for the employees of all these school districts to go ahead and sign up for the majority of the doses that we have for the next 4 or 5 days. Thousands of, a link opened 2 days ago, thousands signed up, a link opened last night. Another 1,000 or 2,000 people were able to sign up to go ahead and obtain these doses. Communications were sent to BOCES and superintendents so they can alert all of their teachers in all the school districts that these links were open. I know that they all filled up, and so for the next 4 or 5 days, we're going to be working almost exclusively with those teachers to get them all vaccinated and get them back into the schools.
Okay. And then my last and final question is going to be regarding this new group that I guess we have some local ability to localized ability to make a decision here regarding taxi drivers, I think it is. Is that correct?
So we did hear, again, on a governor's live stream that it was going to be opened up to employees of restaurants and taxi drivers, Uber drivers, and people of that nature. We have not seen the guidance on it. The guidance that we're working under right now has not yet been modified or amended to include those individuals. I expect that should come down at some point in the very near future, but until we get that, we're still not able to do that population, but we expect that guidance to come out very shortly.
Okay, so my only question regarding that is, would that include Uber Eats or any of those type of food delivery services? If they're strictly Uber Eats or Grubhub or what have you, I would think that they should be considered and included because they probably have the most ability to transmit the disease in so much that they're delivering food to dozens of homes in a day. So if they're not included, I would ask that we consider questioning the state about including them as well. All right, I'm going to end here. Again, thank you.
Thank you.
Okay, we have Legislator Kennedy, then Reggie Whitten, Birnbaum, Schaefer, and Rhodes.
Thank you, thank you, Chairman. Hi, how are you? No, it's been a long one. Just want to thank you for everything that you are doing in the health department. I wish I had the opportunity to thank Dr. Eisenstein as well. I know that I personally, along with a lot of other legislators, have been on the phone with him, calling him, talking to him, texting him 9, 10 o'clock at night, weekends, and I know he's been working around the clock, as have all of you, I'm sure, and it's been a difficult time. And we've been handed you've been handed a difficult, a hard hand to deal with. From the beginning, we'd say that it was really difficult, and then quickly, very quickly, I think less than 6 days, we went from age 75 and over to age 65 and over, when at that point we really were having a difficult time keeping up with those that were 75 years and older. And I know now my mother-in-law is in the next group that was 65, and myself, my wife, and my mother-in-law have been working around the clock, and we haven't been able to manage, we haven't managed to secure an appointment, you know, in the state that's close, let's put it that way. And it does seem like from the dozens and dozens of phone calls from people in my district, everyone is facing the same problem. And it's mostly seniors that are having this issue, who have difficulty navigating the internet, and it's a lot. And we're living in a time where it's scary, and a lot of people are very scared. And earlier, Legislator Ferretti had said that New York City is getting more. I think it's about 2% more based on the population vaccines than we are here in Nassau County. And then also, I know that in the city, they're restricting people from Nassau County to come in. And I know that just makes me question. I don't understand how the mayor can get away with this. I wonder if you can help me here. So why can a site within New York City, which was developed in partnership with New York State, restrict access based on residency when in a county, when pursuant to New York State rules, NASA was told that such behavior violates New York State rules? Do you know how they can get away with that? Because I don't understand. We can't, right?
No, we are in fact, when we have residents from other counties, from Suffolk County or from a city borough, we are vaccinating them, and that has not been a large number, but they do show up, and we are vaccinating them. And we're especially concerned, of course, those that may live in these other places, but actually specifically work here in Nassau County. We want to get them vaccinated. But I don't have an answer to your question in terms that would have to come from the state.
Right, which of course, thank you. That is, of course, the problem, that from the state, we've been dealt many difficult problems that need to be addressed. And that, for one, I would just love to see the county executive talking to the governor more often, more frequently, to try to make him realize that here on Long Island, Nassau County, that we are facing the same difficulties that they are in other parts of the state, and that we need, especially our senior population, who is really struggling, and the population that's disabled. And just last night, I had an email from someone. She said prior to the pandemic, her daughter had attended a cerebral palsy center. Now, she, the woman, her mother, is a caretaker for her daughter, and they've been housebound since the start of the virus. Now, she is upset that both her and her daughter may not be eligible to get the vaccine at this time, since the governor has decided that local governments will now decide if there are enough doses for the disabled. Now, that's only one person, but I'm sure there are many, many people who have those same questions. Someone who's housebound for almost a year now. I wonder what we can do about helping those people.
Well, the guidance just came out this week for us to start prioritizing those that fall under the auspices of the Office of People with Developmentally Disabled. And so we have just started working on this challenging group. They present with a number of issues. Some are very high functioning and ambulatory, and we can serve them without, as we do most of the other population, and some will require a different model to get them vaccinated. So we are just starting to sort through that. This is a population that we don't have a lot of direct contact with because they are more monitored and managed by the state. However, what we found is that they're not out there on their own. They have case coordinators. They have connections with healthcare providers that see them on a regular basis. And so what we are exploring now is tapping into that resource that has already out there for this population. And not to reinvent the wheel, but if there is, if we have a person who sees their healthcare provider on a regular basis, that may be the best way to get the vaccination to that individual. For those that are in congregate housing, some of them have already been getting vaccinations through some of the local pharmacies, others have not. So we're just starting to sort through that group because obviously they just came online and just became eligible. But we're finding that there are resources out there that may be able to assist us in making sure that population is getting their vaccination.
Okay, it's good to hear. I would hope that we keep them in the forefront of our mind. I also received someone reached out to my office, and this person is under the age of 65, but they have several underlying conditions. And anytime he goes to sign up for a vaccination, because of his age, he is restricted from signing up. But he has these underlying conditions. I'm just trying to figure out how has this been working for, because there's many people who do have underlying conditions and would be, that would enable them to get the vaccination. So I'm trying to understand why that is happening, that there is nothing to check when someone is signing up for a vaccination.
Yeah, so at this time, there is no eligibility category for someone with conditions like that we're using that universal umbrella of immunocompromised for some reason. It isn't a drop-down, it isn't a category, it isn't something that we are prioritized, have the ability to do as a priority group. We are waiting for some guidance to come down on that, but until it does, and until the state system opens that up as a category, there's no way we can, that's not a population we're authorized. As much as we want to work with them, we can't do that just yet.
Okay. I hope, once again, that that's one of those things that we can obviously push for the governor to take an active role in. I know that in some places, New Jersey, for instance, there were locations where there were hotlines manned by volunteers, I think young adults, mostly college kids, who take calls and help the elderly to secure vaccine appointments. I was wondering if that's something that we've considered doing in Nassau County, and if not, maybe that is something that would be beneficial, especially to those who are having a difficult time navigating the internet.
Well, what we've discussed, and I'll say again, is that we did redirect some of our staff to get trained so that they could handle the influx of calls. And the purpose of that, the plan initially, was to serve our seniors and to operate just as you say. It would be our staff doing it, not young volunteers. That's a great idea, but we were taking our staff from other departments, having them trained so that they, and establishing a senior calling center strictly for seniors to enable us to pre-register them, and that was our plan. Of course, we've sort of halted that because we're unable to vaccinate seniors. What I can say, and from taking from some of the comments here, is that we consider enabling our additional staff that we've devoted to the call center to continue to assist seniors, even though we are not authorized by state to vaccinate them, to maybe give them more direction, help them along a little bit better. And so we will take that into consideration, because it's so clear to us, as well as all of you, that our seniors have been left out there without a lot of help, and they are in help. Now, we still have our Office for the Aging that's still assist seniors on a daily basis, but specific to this issue and specific to vaccination, we'll take another look there to see what else we can do. But you know, we're cognizant of not sending people on a wild goose chase. We want to be able to give them real information that results in, you know, something tangible, which in this case would be a vaccine or a vaccination appointment at least, that's close by, that makes sense for that particular senior. So that's the challenge for us. But we will take another look at what we're doing there and how else we can help, what more we can do, because that was our whole intention from the very beginning when we redirected the staff and got them trained to be able to help with the calls. So we'll take another look.
So, and I can add to that, if I may, knowing that this has become, you know, a substantial and serious issue for the seniors. What little we can do, we are doing. When we built this database to give people reminders for their second calls, as part of that database, they are now able to communicate with those who can, or family members that can. We have an email box that is now set up that we take emails of all sorts of problems. What we can do for them, and what we've instructed our what we call INR staff and our call center staff to do, is we at least direct them to where the links are. Again, for many of them, it has another family member will assist them, where there are links for them to try to sign up, albeit it can't be with us, but with other locations in the surrounding communities that are for seniors. And there is a seniors call-in number. It's a state number. We give it out to everyone who asks that of us, or who emails to us. We have people that actually go through this email box every single day and clear it out and try to answer as many questions as possible. It's the least we can do, and it's at this point the most we're able to do for them.
Well, thank you. And I know there are many, many young people across this county who want to help, and if it could be something that people who really want to help could be brought together to make some kind of an effort, any amount of help would be great for seniors, because, like you said, there's so many people. There's so many, and we need. Sometimes it's just to hear an answer, to hear a voice, to be able to know that somebody is working for you, because that is also a very difficult thing when people call my office and they say, I cannot get to speak to a person, and I'm so frustrated. I'm like at my wit's end. People are so upset. It's just, we've heard it from everyone. It's the same thing across the board, across this whole county, and it's really, and then as each one is expanded to the next group, it's just in making it more and more difficult. But thank you. And one thing that struck me as soon as this all started, that you could not sign, a couple could not sign up together. I'm curious why that is, because I had several people call my office and say that I made an appointment, and my wife's appointment is 3 weeks from now, and we're at Jones Beach, and so they're going to have to go Jones Beach, and then 3 weeks later, and then a week later because of the other one, and 3 weeks after that. I can't understand how we can't get these senior couples who need to go, and being together would be tremendous benefit, and it's just not good for them to be out, you know, numerous times. Right. I'm just wondering why we could not do that and why we haven't been able to since. You know?
Well, it certainly makes sense, and it's the most efficient way, and it's more convenient, obviously, for those seniors to come together to the site as a couple. And if we're authorized to vaccinate more seniors, that's something that we will do, you know, because it doesn't make sense to do it any other way, really. As long as they're both eligible, right. Obviously it's the most efficient thing, and it's a convenience for the seniors. So if we get to that point where we're able to get more vaccine and authorized to vaccinate seniors, we can make that happen. That makes perfect sense to me.
That would be great. Thank you. I just had one other question. In my district, and it seems like all along the South Shore, it's very difficult. I know Massapequa Park is part of my district, and we were in the yellow zone there, and they've worked their way out. And I know all along the South Shore, I believe Freeport was in a difficult position at one point as well. But it doesn't seem that the South Shore, pretty much across the board is that there are sites for vaccinations, and I feel like that would be an ideal place to shoot for because it's a large population. And it's very simple up and down, Merrick Road, Sunrise Highway. I'm just curious, is that something that's been thought about? Because I know that there were a couple of sites, one of the Northwell, I know there's a Massapequa site in particular, but that was not being used. I think one in Syosset, can't find it right now. But anyway, I'm just curious about that. Is that something that we could see possibly?
I don't know. I know that we, obviously, as Dr. Larry said earlier, we had a plan, and the college was part of that plan. Yes, We Can Center was part of that plan. And I don't know whether we envisioned, where we are right now, and our ability to set up additional pods. And I know that we are constantly reevaluating that, and we'll take a look at what is the best location to pool our resources so that we can get to the greatest number of people. So the South Shore is I hear you. I guess the nearest site for them would be the college. But I will, we can talk about that with Dr. Larry and the whole team as we go forward on whether or not we can and will be opening up pods, and where are they, and what makes the best sense for all of the residents.
Right, I think that we've actually, considered things like that. We're now cognizant that we're a county and there's sizability to the county. I think right now we're limited by the fact that the vaccine dosage is only so much, that we're running 2 pods right now, and we're running through all of our vaccine right now. And so we'd have to dilute down that, and as well as the staffing it takes to then open up another pod with now what is limited vaccine. And I think really we're just waiting to have the greater ability of vaccine to do more things that we would like to do.
Right.
Okay, well, thank you. And thank you for answering my questions. And just, I would like to ask County Executive to just please push the governor to help us here in Nassau County. And I know that you have a very good relationship with our governor, and to utilize that would be fantastic for all the residents in Nassau County. So thank you.
Thank you.
Legislator DeRidge Witten, then Legislator Birnbaum and Rhodes.
Thank you. I have to think it's actually even further up than the state. I mean, it seems like the federal government is, didn't really have a plan in place, and now I think they're trying to catch up. And I do think New York has really been pushing to try to get as many as we can, and I believe County Executive Curran is aware of the lack. I just did quick math. So if we relied on what we're getting now with just what the county's doing, it would take almost 8 years to get our residents vaccinated. And if you go back and look at the polio vaccine in 1955, I mean, there's no comparison. They were ahead of us at the game. So I understand it's a numbers formula situation, and I hope that if Johnson & Johnson comes out, we don't have the same refrigeration issue. Maybe we can go to the senior centers or go to homeless shelters and go to all the places that we have to go to. And I'm praying that, I'm hoping that this is going to happen in the next couple of weeks.
Mm-hmm.
But I just have planning ahead because, we were all hit by surprise with the pandemic. No one had testing. No one had hand sanitizer. Everything went out the door quick. How are we with our supply of syringes? Do you know? Especially the ones that might accommodate the extra dose.
I can tell you, I don't think that is an issue for us. We have been procuring. We are limited in how much we can procure. I mean, when you're seeing the paperwork come through, we're like, why are we doing this way? I asked the question, why aren't we not buying in greater bulk? We're prohibited from doing that by the vendors. So they are controlling how much goes out. But we haven't had any issue in procuring and getting it delivered to us in plenty of time so that we have a sufficient amount of supply for the vaccine. And as we get more vaccine, Obviously, the syringes have to come with it, and so we're watching that very closely. This is not, while we're unable to buy in the biggest bulk we'd like to, so far, we have not had any issue with it.
Well, so far, meaning the numbers that we're dispensing as of today.
Yes, but we're...
what if if Johnson & Johnson comes out, I really think we're going to be given, hopefully a good amount. Are we going to be prepared for that? Do we get the syringes based on the doses we're given, or is it a completely separate process?
We do get syringes with the doses, but we have procured additional syringes because we as Dr. Eisenstein explained, discovered that with a smaller syringe, that there was that we could get an extra dose out of it. So we have a sufficient amount of supply of syringes because we've been buying additional to what we've been given.
All right,
And I will add to that. We have our planning people look at that every day. It's not just putting needles in arms, which is the most important thing right now. It's knowing that they have all the things they need to do that. And so there is someone looking at supplies on an everyday basis, and they're taking inventory on an everyday basis, and we are able to get those when we see that we need another supply of something. We are staying ahead of it, at least a week ahead of it, if not more.
I hope so, because we don't want to get all the vaccine all of a sudden and not have the syringes. That will just frustrate people further. Also, I went into Walgreens yesterday, and the manager actually asked me if assistant manager, whatever, asked me if I knew what was going on with the pharmacies. He didn't even know what was going on, and he said the website had crashed because it was out on social media that Walgreens. So again, we're living in an age where communication and technology should, hopefully come in the better way that it has so far. In my opinion, I just think we have to be more organized with the information just to stop the chaos that people are feeling. And again, I know it's not Nassau County Board of Health that's responsible, but I wish we had a better plan for disseminating the information. All right, and my final question is, right now, if I wanted to make an appointment in the Bronx, would I be turned away? Do you know? 'Cause I don't want to say anything, but I know
I'm sorry, I
people that
don't
are
know the
making
answer to that
appointments.
question.
I don't specifically, I don't know the answer either.
So New York, 5 boroughs are banning Nassau County residents as of right now. Is it just the county, is it the state-run sites, or is it all of them?
I'm sorry, I don't have that information for you.
I believe that the state-run sites are open to anyone. And it's just the city sites, and when you use the portal, it actually stops you from making an appointment unless you live in the city or work in the city.
All right, because I do know that someone made an appointment in the Bronx recently, and also Binghamton seems to be, I have residents also going up to Binghamton, but, again, I'm hoping once the supplies come in and we're prepared with the syringes, and hopefully the locations will have a big turning point at that time. So thank you again.
Thank you.
Legislator Birnbaum, it's on remote.
Yes. Hi, can you hear me?
Yes, we can hear you.
Okay. All right. Thank you for answering all these questions. I know it's taken quite a while, and many of mine have been answered already. But I'm just wondering, is it possible to supply some kind of estimation for when our Nassau County sites will be getting to the senior population based on all the other groups that are before them?
We have been barred by the state from vaccinating seniors. This has, been a bone of contention for us since that happened, and we have been pushing back and asking for authorization to vaccinate our seniors. And so it's a daily request that we make, but we are bound by what the state mandates tell us and who we should prioritize week to week. And unfortunately, we don't, to date, we haven't, after last week, we don't have any further authorization to vaccinate our seniors. So it's not a matter of when we would get to them, it's when they allow us to. We are capable of vaccinating our seniors. We have the infrastructure in place to enable us to do that, but we are not authorized to vaccinate our seniors. So when we...
No, I understand that, but I'm just saying, given the populations that you have to vaccinate first, have you been able to calculate the amount of people that go before the seniors and when you would get, if there were no other changes, no other groups added?
Well, we still would have to be authorized by the state to allow us to vaccinate the seniors. But I would imagine if all else was exhausted, that authorization would come through. But I don't know the answer to that question because there are many, many eligible residents at this point that we are unable to get to. So I don't have an answer to your question. We have not made that calculation because it's so speculative. It depends on many, many factors, supply being one, eligibility, and the amount of people that are in each category. I'm sorry, I don't have a better answer for you.
My second question has to deal with Northwell Health because they're our partner. You work with them in creating the different pods, correct?
They are
yeah.
Go ahead, I'm sorry.
Yeah, no, if you work with Northwell Health in selecting areas where you could create the pods, and they have their own limited amount of places. I believe they only have 3 Northwell Health facilities that I've seen, Lake Success, Hewlett, and Syosset. Is it possible to implore them to open up more sites where they could be inoculating people?
Yeah, Northwell makes those decisions for themselves. They're the hospital system, but they're also the hub, and we get a supply of vaccine from them. And while we have partnered with them in terms of our earlier vaccination pods, and they have supplied some personnel to help us as they open up more pods, they're using their personnel and there's less and less supply of their employees to assist with us, and we're pretty much standing up our vaccination clinics right now with the health department employees of other agencies of this county, members of the MRC, almost exclusively at this point. And so those are our conversations I know that Dr. Eisenstein does have with Northwell and the Northwell Hub, I will take this back to him, but I do believe he is engaged in those kinds of conversations, looking to try to stand up more pods to do the larger populations, to do more individuals. But that's where at this point this is where we stand and what we're able to do as an eligible entity because we do take our direction from the state.
Right, but I'm just wondering, because we are their partners and they're the ones that are assisting the county, why we can't work with them to set up more sites throughout Nassau County, since they're actually the largest healthcare system in the state and they're based right here in Nassau County. So to me, I just expect more from them. And I would also ask for more COVID testing sites. I think at the same time as we're doing the vaccinations, we have to be cognizant that there are many people still in need for testing sites. And instead of shutting testing sites, because there was one up here on Community Drive in Great Neck, they should be keeping them open and having additional testing sites at the same time. My final question is also in lines of what a former colleague was saying about having South Shore sites. I would argue that we need some Northwestern sites in Nassau County because there are many senior citizens who live in this area and they can't travel a half hour, 45 minutes to go to a local site. And I agree with the fact that husbands and wives should be able to schedule together. It's really unfortunate that they have to make 2 trips, and even wherever they get the appointment, one is in one location, one is in another, and that's for the lucky ones. But I think going forward, we should have a system in place where the seniors who can't make an appointment on their computer could actually call, and you can work with husbands and wives to schedule at the same time. Thank you.
Okay. Legislator Ford has a question, then Legislator Rhodes.
All right, thank you very much. I'll be rather brief, but I just want to echo the sentiments of my fellow legislators in regard to our seniors and especially with the pods. I'm just curious, when you reach up to the governor, especially in regard to our seniors and the vaccination distribution, are all of the commissioners of health in agreement that the seniors should be the first ones to be vaccinated, or do we just leave it, or you just wait to see what the governor has to say? Or do our commissioners agree with the governor to just keep opening up the eligibility slots?
So I do know that on the calls that Dr. Eisenstein is on with respect to the New York State Association of County Health Officials, all the health officials and all the health directors, they do echo the sentiment to continue to have vaccine for seniors and how important it is for seniors as a vulnerable population. I do know that the NICE-HO is the acronym for the organization, has reached out to echo that view, and so yeah, there is a lot of agreement with trying to get a way to work its way to the senior population. That is something that consistently comes up on those calls.
And is it possible then to maybe perhaps ask our commissioners of health as well as our various county executives to then jointly write a letter to the governor to say that, this should not be political, that we should defer to the medical experts, the ones that know best, in my mind, considering the problems that we had with our nursing homes. And now, once again, I find that my seniors are, and all of our seniors, are at greater risk. And, my heart breaks for them because I get calls, we get emails from people who are desperate. And a lot of these people are elderly women that have nobody and they're alone. And so I really urge you, and I'm going to ask my legislators to join us, and maybe we should write a letter, a stern letter, supporting our medical directors and saying that it's time that we defer to your experience and your opinions in regard to vaccinating our seniors. And I'm very happy that you are going to reconsider that hotline for our seniors, because I think it's very important that we keep lines of communication open, especially for our most vulnerable. And, what we can do is, even for the seniors, even though if we cannot help them register for their vaccinations, at least we could start a registry of who is looking to be vaccinated and who may have some issues at home. So this could be a database that we can use. And then, and I had offered that I would be happy to volunteer at a later date and to be able to reach back out to the seniors to make sure to find out, did they get their vaccinations? Are they still having problems? Just to make sure that these people do not feel that they've been kicked to the curb and totally left in the dark on everything. And I think sometimes with their loneliness, especially with this winter and being isolated, to be able to get some friendly calls or some calls of concern from different people, I think that would go a long way, especially for their mental health. In regard to the pods, I cannot, I too am very angry that there are no pods, and I'm down on the South Shore. The city of Long Beach is a very diverse population, and I know that the closest county pod is Nassau Community College, but if my memory serves me correctly, there was no direct line that goes, a bus line that goes from Long Beach, from the Barrier Island to Nassau Community College. So I would urge you that as we open up more pods, and I agree with Legislator Birnbaum, let's reach out to Northwell, we could go to Mount Sinai. Let's start getting and working with our medical facilities in expanding the number of pods, especially when more and more vaccines are coming. So I hope, because I do think that we're not serving all of our populations, as well as we can be. All right, but I also want to say thank you all for all the fine jobs that you're doing. I really appreciate all your effort. Thank you.
Legislator McKevitt.
Yeah, I just have one issue, which again, you probably do not know the answer to, but ask for your advocacy on. But I have a parent with multiple sclerosis who obviously is very, very concerned about, with children going to school. So if you know of anything aware of, we're going to advocate the fact of multiple sclerosis patients being on the list to get those vaccines sooner rather than later.
Okay, we actually had another similar comment. Individual with asthma and diabetes type 2. Seeking to get an appointment to, is there specific assistance with people who have underlying conditions, immunocompromised, to advance up the priority list? Are you aware of that? Is there anything specific for someone who has a condition like that?
There isn't at this time. There isn't at this time. However, I think Dr. Larry Eisenstein did tell us this morning that it is something that they repeatedly bring up in their calls with the governor's office, with the state, about getting some guidance for this population. Obviously, these are people that are very vulnerable, at risk, and we are concerned about them. So while they appear to be eligible, we haven't gotten any guidance on how to handle this population. So I know that Dr. Eisenstein is working on that, and as soon as we know, he will be making that announcement and letting all of you know. You probably will know before I know, because I know he speaks to you all every week. So he will let you know and let all of our residents know that they are now eligible, and then we'll start working on getting them to a pod.
Thank you. Legislator Rhodes.
Just a couple of quick follow-up questions, and a lot of what I was going to ask has been covered by other legislators, and I know we're short on time. It sounds as though there's a, obviously there's clearly a distribution problem. And, it seems as though the state's been coming out very slowly with solutions to some of the known problems that have been brought to their attention by the county. Again, talking about the pre-existing conditions, this is a guidance that was issued, this was a directive that was issued by the state that individuals with pre-existing health conditions were eligible to receive the vaccine, yet it's been over a month and no guidance has come down from the state. That's not the county's fault. That's the governor's fault. No one can vaccinate those individuals. And so many of the letters that we have here and comments that we have here is frustration from those residents who are eligible for the vaccine but can't seem to sign up for it anywhere because there's been no guidance that's been issued from the state. And I wish the governor would spend a little less time on book deals and Emmy Award celebrations and more time on trying to figure out some of these solutions. But we have a role to play in this process as well. We were speaking about a list potentially for seniors that want to get the vaccine rather than continuously having them try to get onto the website to make appointments, a list for seniors to say that they want the vaccine and then be contacted when an appointment is available. That might not be a bad idea for it to be done for all eligible groups. It might be a much easier way, and it might be a way to solve some of the frustration that people can get confirmation that they're on the list, and when vaccines become available for their particular group, they will be contacted with an appointment. Is that something that can be brought up to the state? Because I know all of the scheduling for these appointments is controlled through the state's website.
And I'll attempt to answer that maybe even with a better answer. Yes, that can be brought up to the state, but the county has taken, in working with IT and authorization from the county officials, we took it upon ourselves, understanding that there had been problems with this, with the CDMS system, that's the clinical data management system from the state. With all these problems and all the limitations that have happened with it, we endeavored and approached our IT department to create basically what is our own system. Started off with first an appointment system for second doses, and we are now, I say we, IT is building a system for all first dose appointments. And what is the endeavor of the administration and the health department is to create a pre-registration list of all of these people in all of these categories, so we know who they are and we know where they are and we know how to reach them. And this is what we are attempting to do right now. And that platform is being built right now because we do want to know who they are and where they are. That way, at a moment's notice, when we are ready or when we get the vaccine or when we get the authorization, we can go directly out to them, contact them, and have that kind of immediate interaction with them. So it's something we've undertaken ourselves to do, yes.
Do we have any idea as to when that potentially might be online? Because the issues are, obviously the issues are now, and it's wonderful that the county is being proactive in trying to create that database. But obviously you've got people, we have, I don't know, 18 million people statewide, I believe is our total population, probably, with the guidance issued by the governor, probably 13 or 14 million of which are eligible to receive the vaccine, all trying to get a limited number of appointments. So, including our own residents, that frustration is there now. Those problems are there now. That fear is there now. So the sooner that we can get that online, the better. When do you think that we'll be able to put that out to our residents as a way for them to be able to get themselves on a list?
I know that they are in the middle of beta testing that system, and so I think the answer is, and we're hopeful that it's shortly. I can't give you an exact date, but it's something that weeks ago we took to undertake ourselves. But they had to build an appointment system first before they went there. And it's not just that, it needs to be a system that's going to then take all of this information, ultimately, where first dose, second dose, the system communicates within itself and then is able to take that information, all of that information, all of these first dose and second doses has to go into the state database system for immunizations. And we are in the process of doing that third piece of it as well, so that we can force that information into the state system and be completely off the state registration system. And so we're doing all of this simultaneously.
It's frustrating because we've known, the state has known for 10 months. We didn't know exactly when we would be at this point, as far as when the vaccines would roll out, but we knew at some point in time there was going to be a vaccine distribution program, and it's just stunning that these problems wouldn't have been anticipated and that there would have been a fix for those problems, and really it's local jurisdictions that are being left to come up with the solutions to problems they didn't create and they can't necessarily solve on their own. So I understand the frustration from the department. Taking that though, we spoke about Mayor de Blasio restricting access to Nassau County residents and residents from outside of the city of New York to these city-run vaccination sites. And we have adversely impacted communities too. Legislator Kennedy had mentioned that Freeport was a community that was pretty hard hit by COVID. The notion that New York City should be treated differently because of their density of population and because of adversely impacted communities. We have those adversely impacted communities of our own. We have those adversely impacted populations of our own. We have residents that are in need as well. And this is more of a comment than it is a question. Nassau County has 7% of the state's population. But when we're receiving 2,800 doses of vaccine a week, which is what we've received for the last 2 weeks, despite the fact that we have 7% of the population, we're only receiving about 1% of the vaccine. And say what you want about Mayor de Blasio, and I have plenty of negative things to say about Mayor de Blasio, including about this particular issue, but I will say that Mayor de Blasio is out there fighting for the residents of New York City. And it's up to our county executive to stand up and fight for the residents of Nassau County. And right now, I don't see that. Because while Mayor de Blasio is willing to take on the governor, I don't see that our county executive, Laura Kern, has been ready to stand up and take on the governor on a regular basis to fight to get Nassau County residents what they deserve. And that's a disservice to our residents that I hope will be corrected by the administration. I think that the fact that the federal government now is going to be sending directly, it's my understanding, the federal government now is going to be sending vaccine directly to some of the large pharmacies as opposed to it coming through the state, is an acknowledgement that the state's distribution plan has failed. But instead of just talking about failures, we need to be advocating for our residents to be part of the solution, and I hope the county executive will be part of that. For example, there seems to be an abundant supply of vaccine in other parts of the state. The notion that Nassau County residents can sign on and make an appointment in Rochester doesn't seem to make much sense If they have extra vaccine in other parts of the state that are less densely populated, why is that vaccine not coming here to Nassau County and to Suffolk County and the Long Island region where we have such a large population? But we really need to be doing, and in my view, the administration needs to be doing a better job. I can call the governor's office all day long. He's not taking my call, right? But I'm pretty sure that the county executive might have the governor's cell phone number. And I'm pretty sure that if she picked up the phone and called him to talk about this issue and to advocate on behalf of Nassau County residents, that he would take that call, because he's taken that call on many other issues over the course of the last 3 years. So, we need our county executive to join us in the legislature in advocating that our residents be treated fairly and making sure that we get our fair share of the state's resources, which doesn't seem to be happening now. But I appreciate your testimony. I appreciate the amazing work that the health department has been doing in response to this pandemic and in trying to make sense out of a process which is flawed, to say the least.
I will say this in just a very short response, just to point some things out. We are told from the state that the doses that are the vaccines that are handed down at a portion by population of the locality. I don't know that New York City's in that matrix. I know New York City gets their doses directly from the CDC. We also know, New York City is funded directly by the CDC, unlike all other counties, and so, there are those kinds of things that are built in that I thought would be important to point out to the legislature.
Yeah, they get their doses directly from the CDC, but their doses are counted towards the state's allotment. So when the state is saying that it receives 250 to 300,000 doses of vaccine, that includes what's going to New York City. And if it's being apportioned by percentage and New York City's population is not being considered in that apportionment, if that's what the issue is, again, our residents are being disadvantaged, adversely affected by that. The reality is that we have 7% of the population. We're getting only 1% of the vaccine that's being received by the state. That's an inequity that needs to be corrected. And where it seems as though supply is the issue, look, we can put a vaccination site on every street corner. If you don't have the vaccine to be able to hand out, it's not going to matter, right? So we need to get our hands on more vaccine. And if there's more vaccine out there that we should be receiving as a county, we should be standing up for our residents. Everybody should be treated everybody should have an equal playing field to play on. And if New York City is getting more vaccine per capita than the Nassau County residents, and is also restricting Nassau County residents from being able to receive that vaccine, either that needs to change, or we need to be able to put the same restrictions in place to protect our Nassau County residents. Everybody should be playing by the same rules. In my opinion, there should be no restrictions. Whoever can sign on and whoever can get the vaccine can make an appointment and go get the vaccine, but there needs to be a level playing field and everybody has to be playing by the same rules. That's what's fair. But thank you, I appreciate it.
Thank you. Any other legislators have any comments or questions? I thank you so much for being here this morning, for answering all our questions, and again, thank you for all you are doing, and we couldn't be more proud of our Nassau County Health Department, so
Thank you.
Thank you.
Thank you very much.
And just so everybody's aware, committees will start at 1:30.
Mm-hmm.